Hello guys, welcome to my channel SwathiPharmaJnan. Today's topic is miscellaneous antibiotics. This miscellaneous antibiotics are the last category of antibiotics which are not included under any class of antibiotics like beta-lactam, aminoglycosides and tetracyclines and many other. The antibiotics which shows bactericidal property but not included under any class of antibiotics like beta-lactam, aminoglycosides, tetracyclines, cephalosporins, macrolides and so on are considered as miscellaneous category of antibiotics. This class of drugs shows the antibiotic action by chance. They don't have inbuilt antibiotics. They don't have the structure related to antibiotic showing property, but by chance they are showing the antibiotic action. That's why randomly they have collected 4 drugs are there under miscellaneous category. These antibiotics are also called as random antibiotics, which are showing the antibiotic action by chance. Examples of miscellaneous antibiotics are chloramphenicol, vancomycin, novobiocin, and clindamycin. According to the syllabus of RGUHS, we have to study 2 drugs structures. One is chloramphenicol and clindamycin. The first structure is chloramphenicol. Here the phenyl ring is central. There is a center phenyl ring. To this phenyl ring, 2 substituents are attached at para positions. One is nitro group, another one is dichloroacetyl amino group, and propane 1,3 diol are combined together as a one substance which is attached at para position. This is structure of chloramphenicol. This chloramphenicol is used to treat typhoid fever, meningitis, Rocky Mountain spotted fever. It is a type of fever which occurs by one type of microorganism. It is used to treat enteric fever. Chloramphenicol is alternative drug in place of cephalosporins. If the patients are susceptible to cephalosporins or cephalosporins are not showing any therapeutic activity in the patients, then alternative drug for that patient is chloramphenicol. It is used to treat anaerobic infections and intraocular infections. For eye infections and anaerobic infections, we can use chloramphenicol. You can see in the picture there is a chloramphenicol eye drops which is used for intraocular infections. Next drug under miscellaneous category of antibiotics is clindamycin. The structure of clindamycin is almost similar like aminoglycosides, which is a macro structure. It contains hexose sugar. To this hexose sugar at second position there is a methyl thio group and 3 hydroxy groups at third, fourth and fifth positions, and there is a side chain. In this side chain it contains heterocyclic compound, that is pyrrolidine nucleus. Pyrrolidine ring contains methyl group at first position and propyl group at third position. The remaining substituent is propyl chloride and amide group is present. This amide group acts as a bridge between propyl chloride and pyrrolidine nucleus. Clindamycin is a semi-synthetic derivative of lincomycin. It is like semi-synthetic derivative of lincomycin. It is rarely used today and reserved for patients allergic to penicillins. Patients who are allergic to penicillins, to that patients we are using clindamycin. We'll see the mechanism of action of chloramphenicol and clindamycin separately. Chloramphenicol is a bacteriostatic drug. Bacteriostatic drug means which will stop the growth of bacteria by inhibiting protein synthesis. It will prevent the protein synthesis by preventing protein chain elongation. This occurs by inhibiting peptidyl transferase activity of the bacterial ribosome. It specifically binds to the 50S ribosomal subunit and then it will provide the peptide bond formation. This is mechanism of action of chloramphenicol. Next one is clindamycin. Clindamycin also inhibits protein synthesis by binding with the 50S ribosomal subunit of the bacteria. Topical clindamycin reduces free fatty acid concentrations on the skin. On the skin, there will be free fatty acid concentration. If free fatty acid concentrations are more, then the microorganisms growth will occur. That will lead to skin infections. So topical clindamycin will reduces the free fatty acids which are present on the skin and then it will suppress the growth of bacteria. That's why it acts as a bacteriostatic property. And this free fatty acid concentrations and bacteria is found in sebaceous glands and follicles. This is mechanism of action of clindamycin. This completes miscellaneous category of antibiotics. The various references for antibiotics chapter is Wilson and Gisbert's textbook of organic medicinal and pharmaceutical chemistry, textbook by Alagar Swami, Ashtoshkar, Ramarao Nadendla, Foy's Principles of Medicinal Chemistry, textbook of Medicinal Chemistry by Valentin Elango, Medicinal Chemistry by Graham Patrick, and some online platforms to collect the data. Thank you.